Hello everyone, Dr. Matt Finke, Doctor of Chiropractic, back with you again today. Today, we're going to be discussing the difference between a bulging disc and a herniated disc. I get this question pretty much every week at the office. Someone comes in and they were told by their medical doctor, by a physical therapist, or by an MRI report that they had either a bulging or a herniated disc, and they just want to understand what the difference is, what's severe about one, what's the difference between the other. Before we dive into the differences, let me just explain to you what a disc actually is. So a disc, by technical term, an intervertebral disc means it's a piece of cartilage that's between two of the bones of the spine, which are called vertebrae. So intervertebral disc. The disc itself is a cushion. It's made of cartilage. I'm going to show you a close-up model here. So it's made of cartilage. It's a shock absorber between the two bones. Now the disc itself is made of two components. The outer wall of this disc, that's made by a really strong fibrous material called the annulus fibrosus. It's almost like a car tire. It's very firm, it's very strong. The inner portion of the disc, if I were to hold this model up like this, the disc would be located here. The inner portion of that disc is a softer, it's a gel-like substance. Just to give you an idea what that looks like from a diagram, here's the soft gel-like substance called the nucleus pulposus, and then outside that is the annulus fibrosus, the outer wall. So that's what a disc looks like from the side, and that's what it looks like from the top down, okay? What I'm gonna do later in this video is I'm gonna actually show you some MRIs, which will show you both of those visual standpoints of a disc so you can get a better understanding the difference between a bulging and a herniated disc. Now, if we come back over here, what a bulging disc is a very common situation that happens in a disc. A bulging disc basically means that it's swollen, okay? So if you have a swollen disc, it may or it may not cause pain or discomfort. I always liken it to when someone twists their ankle and it swells up and it gets the swelling effect, the edema in there. That's exactly what a bulging disc is. It's a very common situation. There's been studies that show roughly 82 to 86% of people that have no symptoms have at least one bulging disc in their spine. So again, very, very common. Most people don't even know it if they have one. The biggest difference, the biggest characteristic of a bulging disc is that outer wall, that annulus fibrosus, this outer wall of strong fibrous tissue is intact, okay? It's solid, there's no problem with it. So the annulus is intact, okay? Now, if we shift over to a herniated disc is a more severe problem, a more severe condition with the disc. And the main difference with a herniated disc from a bulging disc is this right here. The annulus in a herniated disc has been breached. Now, what does that mean? Well, if you have a wall that's breached or a dam that's breached, there's something wrong with it, and there's something getting through it. In the case of a dam, if there's a crack in a dam, water gets through it. Same with the disc. If that outer wall has any defect to it, then the inner part of the disc can push out through there, which is the second category of a herniated disc. The nucleus pulposus then begins to push through and push out the wall of the annulus fibrosus. So that's what a herniated actually looks like, herniated disc. If I go back to this model, that's kind of what it looks like from the side here. So this is demonstrating a herniated disc that's touching this nerve right here. Now, common symptoms with a herniated disc, usually it's pain, numbness, weakness, usually down the arm, into the legs. So if a herniated disc is happening in the neck, it can affect one side, it can affect both. If it's touching the spinal cord, same with the lower back. It can affect one leg or the other. It could be pain, could be lightning bolts down there, could be burning. You could have numbness in the leg, and most severely, it could cause muscle weakness. If that nerve is severely being compromised by a herniated disc, you could develop weakness in the arm muscles and leg muscles. People drop things, can't stand up and walk, situations like that. Now, all of these we have managed here in our office successfully with conservative chiropractic care. Some of the more severe situations do need surgical consultation and possibly end up with a surgical situation. But chiropractic care is very beneficial. We can definitely help these situations. And as most spinal surgeons would tell you, unless it's an emergency situation, exhaust all conservative measures to try to treat and correct this before going towards spinal surgery. Now, let's take a look at some MRIs, and I'll show you what this looks like from a clinical standpoint. All right, well, now we're back at my office. I have pulled up on the screen here a side view MRI of a patient's neck, just to give you an orientation. This is their mouth, so their tongue's right here. This is the jaw. See their teeth here. Nose and sinuses would be here. Here's the base of the brain, base of the skull back here, and this is the skin on the back side of the neck. So we're going to be looking right in this area here. This dark gray structure right down the middle, that's the spinal cord. And you'll notice there's light gray on either side, front and back, and you see that light gray evenly spaced all the way down. That's cerebral spinal fluid. That means there's good space right down the spinal canal for the spinal cord. Vertebral bones are right here. This is number 2. This is number 3, 4, 5, and so on. And right in the middle here, these dark structures, those are the intervertebral discs. And that's what they look like from the side. Now, the most important thing is to see this light gray space between the disc, the bone, and the spinal cord down the front. You can see these little tiny bumps here, here, and here. Those would indicate disc bulges, swollen discs, where it's nice and flat at this area and at this area. But the most important thing is you've got that nice big light gray space between the spinal cord, bone, and disc. So this is what a normal neck MRI looks like from the side. Now, this next picture of the neck is a cross section. It's called an axial view. So to orient you, on the back side here at the bottom of the picture, that's the back of the patient's neck. Right up here would be the patient's throat. So the patient's laying on their back. This would be the left side of the patient, and then this would be the right side of the patient. So we are looking at the patient basically upside down or backwards. Now in this image, this dark black structure here, that's bone. That's the back side of the vertebral bone. This dark oval in the middle, that's the spinal cord. And you'll notice this white ring around the spinal cord. That's that cerebral spinal fluid that we saw in the previous video. So you want to see that white ring around the cord there. And then here's the disc. Now this is a great picture of the disc. The dark black around the outer part of the disc, that's that outer wall, that annulus fibrosus. And then here's the nucleus pulposus, the lighter gray in the middle. So the gel-like substance in the middle. Other interesting points about this picture, this light gray area here and here, that's where the nerves exit. Those are the holes that the nerve roots exit between the spinal cord and the bone, right there and there. So again, this is what a neck MRI cross-section axial from the top down looks like. Now in this next picture, we did a combination. So over here on the left, this is the side image MRI of the neck, and then this is the axial, the top down. And you can see these arrows, these are pointing at a disc herniation. So when I'm looking at an MRI and I see this, I'm always comparing above. This is normal. Again, you see light gray, spinal cord, light gray, so good space here. But you can see right where the yellow arrow is pointing, how that dark disc is pushing into the spinal cord. If you look at it over on the right side, that cross-section view, you can actually see that the herniation is off to the side. Again, this is the patient's left side. So you can see it's not straight in the middle into the spinal cord, but it's actually off left of center here. So this patient's probably having some left-sided neck, arm symptoms, probably pain, numbness, tingling, maybe some muscle weakness into the left arm due to this disc herniation in the neck. Now the next two pictures are of the lower back, the lumbar spine. So this is the lumbar spine from the side. Again, you see the light gray, that's the cerebral spinal fluid. Here's the spinal cord. Vertebral body, the bone right here, and then in between here are the discs. And again, you see it's nice and flat along the back of the disc here, so no bulging of the disc, nice healthy disc. Good space between the disc, the bone, and the spinal cord here all the way up. So this is what normal healthy looks like from the side. Again, here's the cross section. So this is the patient's back down at the bottom, patient's front at the top. Left side is over here, right side is over here. Here's where the central canal is, where the spinal cord is. At this level, we're seeing individual nerves, which is normal. These two dark spots here, just like we saw up in the neck, these are the holes the nerves exit. Those are the actual nerve, the nerve roots that are exiting through the hole. They have good space around them. And then this is where the disc is located here in the front on the MRI. So this is a normal lower back or lumbar MRI from the side and from the top down. All right, so the last images I'll show you are a lumbar MRI. This is an actual patient of mine, and this patient had a severe herniation, actually called a protrusion. So here's the lower back from the side. Again, front of the body, back of the body, spine in the middle. Spinal bones are these big squares, and then the discs in between. You see where the yellow line is? That's just an indicator line of what level we're looking at. But you can see this disc here have some bulging here, but the one below it, really dark black. You see this lighter area here, and then this darker patch here. This is all disc material. So this disc herniated back this way, and then actually extruded or protruded up behind this bone here. So it went back and up. If we look at it from the side, again, this is patient's back, front, this is his left side, and this is his right side. Here you can see where the disc herniation is right there, touching these nerves here. There's the nerve exiting to the left, nerve exiting to the right. That looks okay, but definitely the disc protrusion or the herniation located right there. And thankfully, we were able to conservatively treat this situation for this patient. His symptoms were left low back pain, hip pain, going down in the leg. He was actually having some left foot weakness as well, and those symptoms have pretty much 100% resolved. He still has some lower back irritation, but all the leg symptoms have resolved, and he's getting back to life. So this is what a herniated lower back or a lumbar disc looks like on MRI. Well, hey everyone, I hope you found today's information interesting. I know it was a lot that I threw at you, some pictures, some descriptions about bulging and herniated discs. What I would ask is this: if you or someone you know has been diagnosed with a bulged or a herniated disc or anything under the sun as far as a disc, if they're scheduled for surgery, if they're having issues with it, please contact me. Share this information with that person. It doesn't matter where they are, but share this information with them so they know that they do have options. I would love to be able to help someone that's in a situation that's contemplating surgery. They get a second opinion. I'm happy to review any MRIs with anyone, whether in Cincinnati area or outside. So contact me here if you have questions about bulging or herniated disc. If you have an MRI you want me to take a look at, or if you or a loved one are suffering with this and would like to try conservative chiropractic care to see if it can help resolve your problems. So thank you so much. Appreciate it. Like, share, subscribe, and we'll see you next week.